Hola and welcome to Vida Consciente, the bilingual podcast where we explore mindful living and conscious lifestyles to heal and transform from the inside out in both English and Spanish. I am your host, Alejandra Aguilera, and I want to thank you again for being part of this community. I hope you enjoy today's episode. Hello and welcome to another episode of your bilingual podcast, The Vida Consciente. My name is Alejandra Aguilera. And like I always say, thank you. Thank you so much for being part of this community where we are here to learn and grow together how to be more mindful and really enjoy the life that we deserve so we can start healing and transforming from the inside out. Today we have another special guest. His name is Ryan, and he's a psychiatrist nurse practitioner. And with him, we're going to be talking about the importance of the mindset and how we can improve our resilience in those moments of challenge and difficulties in our life. So Ryan is not only going to share his own professional experience, but he's going also to share with us his own personal journey, how his own challenge and difficulties in life has been helping him to have a stronger mindset and resilience so he can inspire and help others. So I don't want to talk too much and I want to let him introduce himself so we can start the conversation. And I want to say thank you, Ryan, for being here today with us and sharing not only your knowledge and what you do, but also your passion, because I know it's part of your passion to help others and empower others to help and transform. So thank you so much and welcome to Vida Consciente.
Thank you for having me. I appreciate it. I'm flattered that you thought of me to ask and to be part of your journey and to be kind of in the mindset of thinking how you can help others. And I'm flattered that you thought I can help others. So I do appreciate that. As Alejandro was saying, my name is Ryan Gilbert. I am a dual scoped nurse practitioner. I am a psychiatric nurse practitioner, and I am a family medicine nurse practitioner. Um, I went to school in 2021 at Thomas Jefferson, and I also went to school to Walden University and graduated in 2023 as a psychiatric nurse practitioner. I've been a registered nurse for 11 years, and my my healthcare field started um, about uh, about when I was like 28, 29 in my life. So this was the second career choice, um, and I did business first, and so this is something I've been doing my entire life. This is what I always kind of tell people is this relatively new in my life, and I'm still learning as I grow. So that was just my sweet little introduction.
Well, it's a lot what you have been going through, and it's like from business to be now in the medical field. So, Ryan, let me ask you, what really inspired you to become a nurse practitioner in the mental health? What was your main motivation to do this?
So God, since I've been a child, I was bullied as a kid. And I don't know that I ever fully recovered from it soon after. I held on to it for a while in high school, and I think it played a part in my ability to not grow. I think it hindered me. I think I was allowed to speak for myself, and I think it created like anxiety and some insecurities about who I was as a person. And I think having not dealt with that, I allowed it to put me in certain directions in life, and I think because I wasn't able to grow, it put my life in certain pathways that I knew I could go right, but I felt like I could only go left, based out of fear and anxiety. And having seen some therapists and having gone through life's troubles, um, uh, losing parents, breakups, failures, rejections. I've realized how much mental health plays a part in my life, in my ability to in my ability to try to figure out who I was, what role I felt fulfilled in this world, um, was often masked because I was hiding behind fear. So um, I knew that I couldn't be the only one dealing with this, and I knew that if the longer I the longer I lived in the world, and the longer I talked to people, especially in the healthcare field, once I became a nurse, you, I was able to get a better perspective on like what a lot of people go through, which is a lot of people are really good at expressing their anxiety and their anger and their kind of what drives them. And I've been privileged to be part of some people's most intimate and vulnerable points in their life, near death or dying, um, serious traumatic injury, maybe a victim of abuse, rape. Um, and having seen that, I was like, I felt like I could help these people. I felt like I could relate to these people. And I felt like they weren't alone. And I think it's really important as a human being in the world, to show compassion for those that are going through it because I knew I wasn't the only one. So in becoming a psychiatric nurse practitioner, I knew my goal was to kind of help people from a medicine standpoint, but then also just being an ear. A lot of what I do as a psych nurse practitioner is not, I would say, I would argue 50%, 40% is about prescribing the right medication and knowing the pharmacology. But I would say the large majority is the ability to talk, ability to listen, allowing someone to vent, um, and given someone that space to feel like they can open up about something that might be personal to them that's kind of keeping them from growing, just like it happened to me.
Yeah, and listening to you right now is really brave and it's really beautiful your story because a lot of people don't realize that those difficulties, those challenge, the pain that they're going through is part also of their own purpose in this life. It's part of the mission. So you were able to see that pain into a window as a light for you to improve yourself, to heal yourself first in order to help others and empower others. And this is part of like a having the right and a strong mindset. So you took the right path to say, okay, so I'm gonna embrace this pain. I'm gonna see this difficulty or this challenge as a way to inspire others, but first, like working on myself. And I like what you say also, like as a psychiatrist, nurse practitioner, and I'm a physical therapy too. I see this, and I'm gonna talk about in the United States. So we live here. I don't know about other countries. We see a lot of the easy way to help people is through medication. And I work with patients who deal with a lot of mental health problems, and I don't see there is a lot of help be able to listen to people, take the time to be empath, to just be like you say the ears. So I want you to tell us a little bit in your experience in your work, how what are the main barriers that people have to face themselves to just take that step and say, I need to find some help, and I want to people to be able to listen to me because I know for me, like from my experience, my patients complains a lot about like my healthcare workers, they don't take the time to listen to me. The easy way is always I'm gonna go and they just prescribe me more medication, and they feel like there's no hope. So they just feel like there's nothing else I can do for me if it's nobody else do something for myself too. So what are those barriers that you see on your own patients and how you help them to overcome those?
I think the biggest barrier that people face is their own, they get in their own way.
Mm-hmm.
The barrier is their fear of opening up to somebody.
Mm-hmm.
And and I think anybody in the healthcare field, um, you don't have to be a healthcare provider. I think if you are the person, who's showing him to the hospital room, if you're the patient transporter, if you are the nursing assistant, if you are the physical therapist, and if you're all the way to the surgeon who's conducting the surgery, I think we all play a part. And giving someone um, the compassion that they're looking for, because chances are if you're receiving some kind of healthcare, something is wrong to some severity. And it's usually multi-factored. It's not just knee pain.
Mm-hmm.
Um, it's the knee pain, and then the deficits that come from the knee pain, and the sequela, which is I haven't been able to exercise. Because I haven't been able to exercise, I've been getting really anxious. I have a lot of pent-up energy. Because I have this pent-up energy, I don't know how to channel it, and as a factor, I'm becoming more depressed. So as us healthcare providers, I um, can see and have recognized and been able to distinguish that, like, it's not just it's never one layered. It's never as simple as knee pain. So it's being able to read between the lines, look at their body expressions, look at their body language, the tone, um, see it in their eyes, and be able to ask the right questions about, well, how's it affecting you? Um, how are you feeling about, like, are you scared about anything in regards to, like, what's your hope on your knee getting better?
Mm-hmm.
You know, so one of the barriers is allowing people to feel like they can talk about that. I can't force someone to feel comfortable with me.
Yeah.
God knows I've had patients that probably like, this guy's an a-hole. I don't have much that I want to say to him. Um, but I know that I at least try my best to make them feel as comfortable as they can, so that they don't get in their own way. I allow them the space to talk if they want to talk, and then they come and open the door. So as the expression goes, um, you can lead a horse to water, but you can't make them drink it. So I'm merely showing as the metaphor goes, the horse, the water, they can only drink it. I'm allowing them the space to talk about whatever it is that's going on, by asking slightly invasive questions and allowing them to come in and be like, oh God, yes, it's been such a pain, blah, blah, blah. And, once I see that exasperation in their tone, it compels me to ask a little bit more. So making them feel safe in the conversation. I think another barrier is the some of the stigma that comes with someone not feeling safe about opening up about anxiety or pain. Because sometimes, I think we are a product of our environment. No matter how, depending on how we were raised, if if I didn't come from a household that encouraged me to speak about how I'm feeling, which some households are don't exactly allow that. Um, that person's never gonna that person has been conditioned to think, I'm gonna keep these feelings to myself. This is I can handle this. I don't want to share this with somebody. I will handle this myself. And whatever they've been conditioned, often or not, a lot of people like to suppress and repress it, and it doesn't come out. So it goes back to kind of allowing people the space to open up, um, and make them feel like having depression or anxiety, being bipolar, being having substance abuse history, whatever the case may be, is not doesn't make you weak. It may be scary, but it's not wrong to have these conditions. It's like, I'm not going to fault someone if they come in for that knee pain. They fall in and they have arthritis in their knee. It doesn't make them weak.
Yeah.
In fact, it actually makes them braver for allowing them to feel like, I need to open up to this guy, or I need to open up to this woman. Here's my shot. Let me muster up the strength and the courage to talk about what's been going on with me.
Yeah.
Um, and I think the biggest barrier is just our healthcare system. Unfortunately, I don't want to bring politics or money and things of that sort into the play, but that is the reality. At least in America, and I can only imagine it's not much better elsewhere. The ability to find a therapist under affordable cost, um, sometimes it's just not affordable. Um, there are plenty of websites, and there are people I have in my own personal network that provide therapy for a lesser cost. Um, but it's allowing people the space to provide them to make that decision if they want to. But if they do, connecting that gap and be like, hey, I have a therapist I can refer you to, or hey, there's a website you can use that you can find a therapist. Or hey, how would you like to treat what it is that you're going through? Do you want medication? Do you want to try some non-medicinal ways, or do you want to do both? And having that access to get there, we we live we live in America where it is capitalism, it is money. And if you don't have a job, it's really tough to access healthcare. So I think that's another barrier.
Yeah, and no, and you're right because we're talking here about more holistic kind of treatment, and I see the
Yeah.
saying that you just explain it. Because I think one of the like the stigma that you say is like a people don't want to look for like a therapist or help because it's like a I don't want to look weak. I don't want people to see me vulnerable. So I feel sometimes there's that stigma that we have to have a specific um, problem or really challenge in order to find help. And in my opinion and my experience, I think we all benefit from any kind of therapy, from counseling, from therapy, from coaching. Me personally has been helping me a lot. I didn't thought that I need therapy. And the first time that I have a therapist, I was like, I don't even know what I'm gonna talk to you. I just here because somebody recommend me, and I finished the session like I even crying. I was like, oh my god, I really need help, and that has been helping me a lot just to get to know more about, like you said at the beginning, who I am, what is my purpose, what I really want, and connect my profession with my own personal experience and help others in a different way, in a better way. But if it wasn't for that therapy, I wasn't able to realize that thanks to those challenge and difficulties that I has been in my life, it's part of my mission. It's part of who I am. So we need to break that stigma. Like you need to have really difficult time for you to find a therapist. And one of the things that really surprised me, and I want to talk about this a little bit more, when I just started working in this country, and I was doing my the history, the evaluation of each one of my patients, I was really surprised. Doesn't matter the age. It was people with in their 20s, and their 30s, 50, 80. They all have the same diagnosis, like a depression, bipolar, and anxiety. And I was like, how is this possible? Like, how you can just figure out someone have this without really getting into more deep details or like a evaluation of this. And I have one personal experience with one of my patients. She had cancer. She was on her 50, and I was doing therapy with her. And one of the doctors just came, sit next to her, and she just started chatting and say, "Hey, one of the nurse say that you are not really eating, that you know want to socialize, and I think that you have some kind of depression, so I'm gonna prescribe you more medication." My reaction was like a woman. She just have cancer. So because she's not eating and she's not really socializing, it's more medication that is gonna help her. So how we can start changing, or you in your experience in the medical field, are you seeing any change that improve this education to patients rather than just always going to the easy part of just prescribing medication? Do you think there is a change or a future change on this?
So it's there's been a small shift
Hmm.
in the increase of the availability of like uh, apps on the phone. Just naming off a few. Sure, there's a whole lot more. Calm.
Hmm.
Um, there is Calm. It is Go Breathe. Um, it is quieting the mind, and those are just a few examples of meditative type purposes to
Hmm.
kind of sit through. Meditation has been like studied. There's been systematic reviews. For those that don't know, systematic review is something where it's some doctor or somebody of a profession studies a hypothesis such as does meditation actually work for depression?
Mm-hmm.
And then they get a whole large sample, call it 5,000 people, 10,000 people, and study those who have um, done meditation, and they do a placebo group. And long story short, they try to determine, like, does meditation actually help these people? And was there actually a change in their depression? Was there a change in their anxiety? Um, and there has been so much studies that so with these systematic reviews, doctors then review these studies to then validate, yeah, these results were good. Like this person got a good sample size. They were able to find that there wasn't any demographic sway, there wasn't any influence in the demographics, whether female, men, or women. So to make a long story short, these are highly validated and accurate reviews of how meditation has helped so many people um, to kind of sit through their anxiety, sit through the depression, and kind of sit in their discomfort, knowing that knowing that it's going to be okay without being anxious of how to fix the problem.
Mm-hmm.
And being in the world that we live in, pharmaceuticals are the quick fix.
Mm-hmm.
It's not as always as easy to have a conversation. And for someone who, in your example, is going through cancer, that patient going through cancer, um, it all depends on their mindset, right? It all
Mm-hmm.
depends on how bad their pain is. It all depends on their willingness.
Mm-hmm.
I mean, when you're suffering from years of cancer, you've been consumed by your medical ailments, and you are tired and you are fatigued. And sometimes when someone tells you, and tries to kind of convince you to kind of do something with a slower fix.
Mm-hmm.
Hey, if you do about 6 months of therapy, we can get you out of this depression. Or if we, how about you practice meditation? I'm going to refer you to a meditation therapist, and so forth and so forth. And you tell them, the outcome, the relief. You might get relief in about 3 to 6 months. It's dependent on each person. Sometimes that person's like, I don't want to sit
Mm-hmm.
through 6 months of that, right? So it's being able to kind of carefully articulate um, the outcomes of each, because I like to be realistic, and um, I like to be realistic and forthcoming with therapy and what they can expect. Because I know if you're on the other side of that, you want to know when you're going to get relief. Um, I know for me personally, I try not to do pharmaceuticals if I don't have to. I don't believe that is always the quick fix. Sometimes it is mind, body, and spirit. Sometimes I'm not personally religious, but I am open-minded enough to understand that how religion has helped thousands and millions of people. So when your cancer patient's coming into me and they're like, I don't want to do SSRIs. Um, that is an anxiety. There's a class of medications that help people with depression, anxiety. I don't want to do dopamine agonists and all these pharmaceutical classes that have side effects, and they kind of just outright just tell me I don't want to do meds. Um, it's something where I tell them, okay, listen, like we have other options. That's fine. But I want you to be realistic about what your expectations are, about how fast you can find relief.
Yeah.
Medications do provide quicker relief, but I would say you're more than likely fix the underlying problem and get longer term resolve if you do some things the non-medicinal way, such as going to church, finding religion, finding support groups, finding meditation, changing your diet in whatever capacity. We talk about their sleep hygiene. Um, I talk about what their exercise routine is like, and their overall health, and like what they're eating. So there's it goes on to say, you can do acupuncture, you can do chiropractic, you can do um, physical therapy. So it kind of all depends on what's ailing the person, but I always kind of try to work around the fact that, like, it doesn't have to be pharmaceuticals.
Yeah.
Pharmaceuticals can be a band-aid sometimes. So as much as I've had to learn all about that, I don't believe it's a quick fix. I don't
Yeah.
believe that's the only fix.
Yeah. And
to answer your
I'm
question.
glad that you bring that up because you're more like a holistic practitioner, which I do the same. And we are, I like to educate my patients like we are more than just a physical body. We are a physical, emotional, and a spiritual body. And each of those body have symptoms. We have treatment for those. And when you say the spiritual body, I don't like to always mention the religious because we have to be careful because some people don't believe in that. So it's like the spiritual body is your inner self. It's just connecting who you are, finding your purpose, finding your mission. So but it's the education part of like a there is more than just a physical body that we're treating. There is more than just a medication that's going to be the quick fix, which is good. And I think this education needs to be provided more in different healthcare workers. Now, let me ask you because we're talking here a lot about mindset and the importance of having a strong mindset and resilience. How you can explain to someone who is new into this what is to have the right mindset and being resilient because sometimes like people don't really understand what is like a okay so I want to have a mindset. It's so easy to say it but it's hard to do it because we cannot just avoid challenge. We're going to go through challenge difficulties in life, but how with a strong mindset I can see and face those challenge in the right way that is going to be for my benefit.
So, are we talking from a provider standpoint or as a patient standpoint? If I'm talking to a patient.
Well, from the patient, like I'm the patient, and I hear a lot about mindset, and I want you have to have a strong mindset and be resilient. How you explain that to someone in an easy way, and how you can provide that advice, and what techniques the person maybe a step to start changing that mindset.
Yeah, and that's where a lot of cognitive behavioral therapy comes in. So, I mean, generally speaking, depending on what the problem is, right? The mindset um, may have to be stronger or weaker, depending on like
Hmm.
what the person's going through. So, let's just go back to the same example about the cancer patient. Um, a very traumatic ailment, sometimes incurable. Um, and if you're lucky, it goes in remission. But the mental anguish of waiting and seeing when and if it's going to come back, and having the mindset to persevere through that and be resilient, um, that's like easier said than done. So when I'm talking to people like that, and they are like they're scared,
Hmm.
they're sad, um, we have to kind of figure out what tools and resources can they use to fulfill a stronger mindset. I kind of see like what's in your toolbox. Show me what you got in there. You got a hammer? Is that just a hammer? Do you have a hammer and screwdriver? Do you have a hammer and screwdriver, duct tape, a drill, some glue? Um, when someone's full of those tools, I think your ability to create a stronger mindset becomes a lot more easier to apply. Um, so I like to kind of understand like, all right, do you have support at home? Are you seeing a therapist? Do you have a significant other? What are your current stressors? Can we kind of work on maybe eliminating some of them? Um, some people like to be Superman. I'm kind of guilty of that. The analogy or the metaphor I'm trying to say is some people just want to like place all this load on them. All right, I'm gonna fight my cancer. I'm gonna be a mom to my three children. I'm gonna be a wife to my husband. All right, I'm gonna take care of my dying mother. All right, got to work overtime this week. And if you think about that person who exists in the world, having the mindset to persevere through that, um, that doesn't sound reasonable for anybody. I don't care how strong you are. I don't even care if you're Superman. That will eventually wear and tear you. So I think trying to understand what are we working with? What tools are we working with? And how much are you putting on your plate that would burden your mindset and would inhibit you from allowing to be stronger, persevering, resilient. So I think to help someone create a stronger mindset, it is to um, establish exactly what kind of tools they have, And I say to them, like, are you willing to you're willing to start praying and maybe see a go to start practicing your religion. I'm not religious. All right, well, what do you think about being spiritual? And I would say, all right, well, there's a couple books I could recommend. And if they said, oh, that's just not my thing. I said, well, why don't we try about therapy? I'd really like for you to start switching with enough cognitive behavior therapy. We can start switching the mechanism in our brain that perceives fear and triggers us to go into scared mode, go into a mode of I can't handle this. I'm cracking at the seams, and you start crying and you start feeling like vulnerable and you start feeling like hopeless. That's when I say, speaking to a cognitive behavior therapist, they can change that mindset to start restructuring your brain to react differently in times of fear, hopelessness, desperation. Um, and if it's not changing the mindset through that avenue, I always say, like, tell me what makes you feel strong. Let's be facetious. For me, I personally going to the gym and working out and achieving and finishing the workout um, makes me feel empowered. And I'm like, look what I did. I was tired. I ran on 2 hours of sleep, and I still went to the gym today. Because sometimes it's just about showing up for life, and kind of giving yourself that credit and not being so hard on yourself to change that mindset to it's not necessarily about the destination as much as it is about the journey of how you got there can be self-empowering. But it's all, it's about that perspective. Um, so I try to question people's mindset in terms of like how hard are they being on themselves? What tools do they have? And how can we use their own strengths to advantage them to have a stronger mindset and a more resilient mindset? We all have this innate ability. We all have strengths about us. And I think as a healthcare provider, it's understanding, let me see what this person is good at, mentally for how they can help themselves get out of this little funk that they're in. The challenge for me is, unfortunately, in the healthcare field, I get 15 minutes a patient. 15 minutes. They come in literally with a laundry list of things like, I got this I gotta tell you about, I got this I gotta tell you about, I got this I gotta tell you about, oh, forgot to tell you about this, oh my God, and this got this other thing. And, in a 15-minute window, I have to also check on their mindset. How can we make this feel more empowered? And so in a perfect world, having this conversation that we're having now, if I got a half hour, I mean, I could do so much better. But the nature of the business is that unfortunately time is money, and I get 15-minute slots to conduct this. But I wish in a perfect world I can get a little bit more time so I can have these conversations a little bit more on a deeper level.
No, and I like what you're saying because it's like a peeling off different layers onto the person, like a helping them to really break up that wall until they can see the other side that they don't want to see. And you saying this is like, okay, you have 50 minutes, which is, yeah, it's nothing. Just the person comes, sit, and you guys start talking, and the time just fly. Like you don't have enough time. That's why I personally I have to face that before when I was working in different outpatients clinic in the hospital. I was like, this is not for me. I need to have my time with my patients because sometimes, in my experience, they don't want to do therapy. They just say to me, "Can we just talk? Can we just like go for a walk and talk?" That's why I just more like independent because I see the importance of bringing the mental health into the table into each one because that's how they're going to heal. That's how they're going to really see the true healing because it's coming from there. Now, before we start like finishing, because I really like that type of practitioner that you are, because you sit and you start asking questions. People sometimes they don't even know the answers of those questions. They don't know themselves. So you helping them to figure out what is the problem and where the problem is really coming from. Now, as a practitioner, because that happens to me, and I want to ask your opinion. For me, at the beginning was a little bit hard because I want to help them. Sometimes we also think like we can change and we can help and transform the mind of a lot of people because we have been able to do it. I have sometimes faced frustration because it's like a, oh my God, you have the power to do it. You can do it. And I have to face myself with that frustration that they don't see their power that they have. How you has been setting those boundaries, or you as the doctor, like trying to don't let that when someone really don't want to change, when someone doesn't really want to be helped or listen, how you handle that?
So you're talking about the patient that doesn't
Really
come,
want,
comes
yes.
but doesn't want to comes but doesn't want to receive help.
Yeah, and you know that there is a really potential from there. They have power. And obviously, we want to help them. We want to make them believe that there is a hope and they can heal from themselves. But they don't want to take the chance. So you as that doctor, as the practitioner, how you don't take that and don't let that affect you.
Well, I've learned not to take work home with me. I've been able to compartmentalize when I leave. I'm concerned about food. I'm concerned about taking a shower. I'm
Hmm.
concerned about walking my puppy, and I want to go to sleep.
Hmm.
And I find that in the beginning, when I was taking work home with me, it would just cause me to be stressed, lose sleep, and peace of mind was taken away from me. So, fortunately, it came more natural to me not to take what happens at work personally. In in the psychiatric field, more especially than any other field,
Hmm.
you can have some patients there that are violently aggressive, they're angry, they are agitated, and they have a very short fuse. So it does not take much at all to offset them. Just even look at them the wrong way and not say a word and be cursed at and be asked, what am I looking at? And are you going to do something about it? And they almost want to fight me.
Hmm.
And so as a healthcare provider, I've learned I'm not here to I know my intention is to help you feel better, and I'm here for your best interest at heart. So I've really have truly learned not to take it personal when somebody doesn't want to receive help. Um, it is it is not my job, in my personal opinion, to force someone to get help. Um, if you're showing up to the appointment, that means to me that you want help. You didn't just waste your money, drive all the way down. Now, there are the exceptional people who come in and say to me, I'm just here because the old lady wanted me to come here, and, or my husband, told me to come, and this, that, and the other. And I said, all right, well, how can we make them happy? And we start kind of joking around about how we can make the person that made them come happy. And I said, in reality, would you have came if they didn't tell you to come? And they look at me and they say no. And I said, but you're an independent person with an independent mindset. Truth be told, I don't think you would have paid $30, drove here a half hour just for them. Now, maybe there's truth to that, maybe there's no truth to that. But at the end of the day, you just showed up here. So why don't we make the best of this? And why don't we see what we could find out how to help you, help them, help you, help me, help you. Um, when they're not like, nah, I'm okay. Um, a powerful a powerful tool that I use is paying someone consequences. As a child, if you told me, put your hand over that stove, you're gonna get burned. Sometimes I need to find out for myself, and other times the thought and the idea of getting burned and the consequences of what it would be to receive a burn on my finger and what that's going to feel like, and having my parents describe to me, this is what's going to happen if you put your hand over that flame. That's kind of how I have to talk to patients, not as children, but I say, all right, so here's what's going to happen if I don't check your blood work for diabetes. Your diabetes can get out of control. You may start to have numbness and tingling. Your kidneys are going to start to fail, and so forth and so forth. And I'm like, and one of the biggest complications of diabetes is amputations. So how far do you want to take this until you want to start doing something for yourself? Um, and sometimes the fear and the consequences of their lack of their own actions compels them to be like, all right, okay, all right, let's do the blood work. And because they kind of think, kind of challenge their rational mind without being confrontational. I challenge their thought process. I'm like, do you really want to find out what it feels like not to have a knee or a leg? Do you really want to feel like what it feels like to walk on pins and needles every day of your life? Do you really want to see what it feels like to piss out blood? Um, these are just a million examples of things that will happen as a result of not taking care of your health care. Um, and so forth with the psychiatric field. It's they come in and they're like, I don't want to do medication, this, that, and the other. And they tell me that they've been suicidal for the last 4 years. And I'm like, at what point do we want to find out the hard way? I mean, don't we want to see if we can seek help and find hope in this? Let's see if we can actually take a chance on yourself, and let's see, prove me wrong. Give me 1 month, and I kind of challenge their thought process. So it's kind of finding it's kind of finding an ability to channel into challenging them, because a lot of people don't want to fail challenges, and some people don't want to rise up. But it's kind of understanding the tone of the person, the body language, to understand, is this person going to respond to a challenge? And you kind of have to understand, like, how is this person going to how can I make this person respond to wanting to help themselves? Um, and it's again, this is just through listening, looking through their eyes, looking into their eyes, seeing their body language, seeing if they have fear, and kind of channeling all that into helping them help themselves.
Yeah, that's true because like it's like you say, is you can see who is going to be willing and who is not going to be willing to like really participate. But I like your powerful tool, like let's put all the consequence on the table and then you can decide from there because it's going to be your consequence, not my consequence. It's the one, you are the one who's going to deal with that, not me. So I'm here just as a tool to help you to avoid that. So I like what you're just saying. Now, just to finish here, what recommendation do you give to those who are dealing right now with a challenge, with a difficult time, and they are afraid or they don't feel ready to look for some help, for some therapy? What advice do you give to them so it's not too late?
Yeah. So all my trials and tribulations came through, I've had a prior history of substance abuse. Um, I mentioned depression,
Mm-hmm.
anxiety, severe bouts of it, and even sometimes even feeling like I didn't want to be here anymore.
Mm-hmm.
Um, and in all of those situations, I learned once the pain got great enough, I was willing to make a change. Um, Fortunately, I was able to make a change before there was a devastating consequence. Um, it's been my it's been my view in the world and the shift of mental health and how and where it's going that I mean, God knows that there has been so many COVID was an awful time.
Mm-hmm.
And it goes without saying that it was just awful. But one of the beautiful things that opened up as a result of it is how it really allowed people to channel and open up about their mental health,
Mm-hmm.
and how a lot of people couldn't, we were all going through the same thing. And I think the world discovered how a lot alike we were.
Mm-hmm.
There was a lot of diversity, but I think the one thing that we all shared is that we had to stay in the house and isolate. For the exception of a few bad apples, but for the most part, most people had to experience the same thing the entire world did. One thing I think everyone thought of, experience at some capacity or another. Some people found out shorter than others, but we all kind of found out like, wow, this staying inside my house is getting really, it's really getting to me. And I think we all experienced that unanimously in the world, feeling I'm not doing well. This whole COVID thing and the fear of dying and all this stuff, that's really getting to me. So I really feel like that has opened up a world of where people are now allowed to open about their mental health, and it's no longer a stigma, um, and I think if you're suffering from substance abuse, if you're suffering from depression, if you're thinking about suicide, Um, I've I personally have came from what I think are the darkest places that the world can take you, um, and having felt, an utter sense of desperation and hopelessness. Um, I was lucky to have support in my life, and I was brave enough to find the courage to like talk about it. And I've been on the other side to know that there was hope, and I've seen other people come out of it. And I always encourage people, anybody, like to ask for help. And I think one of the biggest flaws and the hardest things that we have as human beings is the ability to ask for help. I mean, we come into this world independent, but in reality, human beings are innately social creatures. We need each other to exist, and to coexist is to be human, and to be human is to show compassion and be helpful for other people. And with that being said, I can't speak enough on um, how easy it was once I asked for help, how easy it was to receive the help. It was just getting out of my own way, just getting out of my own way and be like, let me receive this help. So if you are struggling, please reach out to your nearest healthcare provider, a friend, someone who cares for you. Um, there is the 411 suicide hotline, I believe. Um, and if you're local in the area or if you're ever suffering, my email address is Ryan S. Gilbert 425 at gmail.com. My phone lines are always ringing because I am a healthcare provider. So as far as I'm concerned, I am working 24/7. But with that being said, ask for help, and don't suffer alone because there is a way out. So that's kind of what the advice I would give to somebody.
Yeah, I think that's the first step. Just acknowledge that you need help. And sometimes it's hard to accept that. It's hard to really accept that we have and we need some help. So I think that's the most important step. And I really want to thank you and say to you that it's really brave of you to open up, to be vulnerable, to share your own journey, the pain, the challenge, and how you has been able to have a strong mindset and resilience to heal, to improve yourself, and also how you empowering others to do the same. So I feel like, well, I don't say I feel, I think the world need more healthcare workers like you. So I really appreciate your work, and I hope that this can be an inspiration and motivation for more healthcare workers because we need that. People need that. People need someone to listen to them, to be there for them, and then just don't just be a quick fix because then it's not gonna be like a healthy society. So thank you for opening up. It's no everyone have that courage to do it. So I appreciate that your own journey, your own difficult and challenge is part of your mission in this life. And then you are doing that right now and helping others to do the same. And thank you for being here, for sharing that and taking that time to the others. So I hope that people there can be, I'm ready to take a step and I'm not gonna wait until those consequences. I'm gonna start finding help. So I'm gonna put your email on the description of the podcast so people can reach out to you if they have any help regarding anything. Just ask for help. It's not bad and it's not a sign of weakness to ask for help. And I say that for myself because once I start asking for help, believe me, the power that you feel is way better. Thank you, Ryan, so much for sharing your story with us.
Thank you for having me. I really appreciate it. It's been a privilege and an honor to speak with you and kind of share my voice. Thank you for
No, you're
providing this
welcome.
platform for everybody. I'm sure everyone's really grateful that you have this.
Thank you, thank you, thank you. And everyone, I want to say one more time, thank you for listening, for allowing us to be part of your community. And then we just here helping and growing together. And I will see you in another episode. Ciao, ciao. Thank you.
Bye.
Let me. Thank you for listening. And if you enjoyed today's episode, don't forget to subscribe, leave a review, and share with your friends. I'll see you until next time. Ciao, ciao.